Welcome everyone, and this is the Camden. She's laughing. But this is the Camden COVID question and answer. It's been put together by Camden Council with the Camden New Journal. I'm Richard Oasley from the Camden New Journal, and I'll be chairing the questions tonight. And just a thank you to everyone who's agreed to take part, everyone who sent questions in, and the council who have done a lot of work putting the event together. We said at the start of the pandemic that our role as a newspaper would obviously be to challenge things that that happened during the course of the pandemic, but we also wanted to make sure that we were a kind of a place for good public clear information, and the council have been publishing an insert in the paper every week with signposts to help and services that people may need. And this is kind of an extension of it, because we've kind of put it out over the last couple of weeks. Have you got any questions? Because things are opening up again. Lots of interesting questions about vaccines that people will have tonight, and this is their chance. If you have got any questions to these experts that we're going to introduce you to in a second, you can still get them in by logging on to the Q&A at the bottom if you're joining us tonight, and I'll put them to the panel today. And we've got lots of questions that we already have here. Just to remind everybody that this is being broadcast to YouTube, and there'll be a recording of it. And so we might be able to go back and look at it again. So who's not here? Who's not here? We'll be able to see. The answers. So I think a lot of the questions there'll be lots of people interested in the answers. So we'll be able to see them. So we'll just go through and see who we've got here. Councillor Georgia Gould, you're first.
Hi everyone. My name's Georgia Gould. As Richard said, I am a ward councillor for Kentish Town and leader of Camden Council. And
we've got Sally McKinnon.
Hi everybody, I am Sally McKinnon. I am the Director of Integration for Camden NCL CCG.
And Dr. Jonathan Levy.
Hi, I'm Jonathan. I'm a GP in Kentish Town at the James Wigg and Queen's Crescent practice, and spend some time vaccinating and supporting the organisation of the vaccine clinics.
Lovely. And we've got Fanny Mohammed. Is she here? Fanny?
Hi, sorry. So hi everyone, I'm Fanny Mohammed. I'm a practice nurse at Hampshire Group Practice, and I'm actively supporting COVID vaccination program in Camden.
And Dr. Ehsan Al-Kizwini.
Hi everyone, Ehsan, GP in West Hampstead Medical Centre. Also work for the local clinical commissioning group at North Central London as a digital lead, and formerly a PCN clinical director.
Thank you. And Anisha Rahman. She here?
Hi, I'm Anisha Rahman. I'm a young person, and I'm the co-chair of Fitzrovia Youth in Action, and I'm a member of the Royal College of Paediatrics and Child Health Engagement Board.
And we've got Helen Asquith as well, I think, haven't we?
Yep. Hi, I'm Helen Asquith. So I'm a public health doctor. I work for Camden Council. I've been leading the COVID outbreak response, and yeah, really happy to answer any questions.
Fantastic. And then finally, we've got Piers Simey. I think, is that how you spell? I hope that's how you pronounce your surname, Piers.
Yeah, spot on, Richard. Yeah. Hi everyone, I'm Piers Simey, Acting Director of Public Health.
And I think Piers is just going to kick us off with a bit of just an overview of what's going on, because there's lots of, it'd be good to know what the kind of picture here is in Camden. We have kind of lots of different stats and graphs and all sorts of things, but maybe you could just give us it's straight into screen sharing. There we go. We're going to have an overview of just for 5 minutes before we get into the questions to see where we are in Camden. So take it away, Piers.
Brilliant. Thank you, Richard. And so I just navigate this. Sorry, just one moment. Okay, can you see that all right?
Yep.
Brilliant. Okay, so evening everyone. Just wanted to give a rapid overview through a sequence of graphics around where we're at with COVID right now. Won't do justice for all the detail, but some key themes. So first off, and I promise this is the only graph that I put in, but I just wanted to show along here around the passage of COVID from September through to April, how we had many infections over the New Year period, plus or minus, and then how we've gone down so dramatically since to have very low infections in the borough, round about the 30 to 50 per week, when during at the start of the year we're upwards of 1,000. But clearly, this is something that we've seen in other areas, that if you come out of lockdown too soon, you can quickly spike up. So this is something we're all very conscious of, but it's a good starting picture for this evening. So I just wanted to flag, in terms of the numbers of people who've had first vaccinations in Camden. It's an amazing effort. More than 86,000 people have had a first jab. More than 30,000 people have had 2 jabs. And it started on the 8th of December, and in 4.5 months has ramped up from 0 to an amazing effort across the piece. And what I've taken from here are a number of people who've been out on media or social media, some celebrities, some health professionals, some COVID health champions, just to illustrate the spread of vaccination in Camden. But clearly there's an issue around all our communities taking up the vaccine in the same way. And confidence and access are 2 key issues we've been working locally and regionally to be able to improve. And we know from national and local data that some communities are just not accessing the jab as much as others. There've been a range of national communications to address this, and I don't know how many people on the call saw this clip. I looked at it again this morning, and it just speaks the power of words in terms of a letter to loved ones and not missing out on the vaccine and talking directly to Black communities around this. Then also what we've been doing in Camden is seeking to work with local community and clinical leaders and staff to put their face and their quotes to stuff that's going out on social media, a range of different media around what they see as the benefits of being vaccinated. And this has been going out prolifically across the borough. Hopefully many of you have seen these, but just being able to really try and address vaccine confidence across the board. And clearly, as we'll touch on within this webinar this evening, vaccine confidence, by having the program developing in real time, a lot of the headlines go into the news, sometimes early, sometimes these can affect our confidence. And this infographic here, just picked out in terms of the news stories a couple of weeks ago in terms of the risk of blood clots for AstraZeneca. And on the left-hand side, you see the 4 cases in a million potential link behind the vaccine and blood clots. And on the right-hand side, you see the consequences of COVID infection lead to almost 1 in 5 people potentially having a blood clot. And in the middle, there are a range of different things we do, medications, and there are a range of things we could have put in here which have a higher potential risk of blood clot, but because we're aware of this and it's part of our daily lives, if you like. So I just wanted to put this infographic up to illustrate something that's been very prevalent in the news around the vaccines. And then in terms of accessibility, and my thanks to Sally and her team for this slide, just wanted to put it up to show the breadth of vaccine sites across the borough, 15 community sites, just showing a range of ways for people to access the vaccine program when they've been called. And then just putting in one specific feature from the Queen's Crescent Community Association held a pop-up. Picture on the left, I think, is courtesy of Jonathan on the call. I should have given you copyright. But just showing where more than 100 people were vaccinated in a community centre, and a great opportunity for some positive coverage, media and other messages between faith and community leaders and clinicians as well. But clearly, we're keeping a very close eye on variants. It's in the news all the time. And I think for me, there are 3 core messages behind this. We know that the current variant, the Kent variant, which has been in play in London for a while now, the vast majority of cases in London are from this, upwards of 95%. We know that this variant spreads better than others, but actually the vaccine works very effectively against it. So for me, the key advice around variants is to focus on what's in front of us now and respond to any changes down the line. This is very topical. Now this slide, fairly busy, just for detail, on the left-hand side shows the steps that we've already taken out of lockdown. A step 1, maybe 1A on the 8th of March, and a 1B on the 29th of March, a significant shift on step 2 on the 12th of April. Built into this process, which is the national timetable we're aware of, is a minimum date before we proceed to another step, which enables a very thorough review about any impact of the changes on infections or on the NHS activity within that. So on the right-hand side, no earlier than the 17th of May, to emphasise step 3, range of measures that come in here, more indoor hospitality, but clearly it's not a cert on that date, and actually it's not an absolute cert that it will happen, but this is clearly the direction. And then just my last slide on this whistle-stop tour, reducing spread, the essentials of prevention, the basics still apply, hands, face and space, with the addition of the fresh air and vital ventilation in the mix, which is so vital for reducing spread. So I've gone through this whistle-stop tour, but that's all from me, Richard.
Thanks, Piers. I think we're all relieved that Joan Collins has got her vaccination, so thanks for that. We'll go straight into the questions, though, because some are building up on the Q&A, and we've got so many to get through from that were put in through in advance. And I know Dr. Ehsan has got to leave at 6:30, so I think we'll go straight into some questions for him, if that's okay. And one that's come through here, Doctor, is I'm confused by the different vaccines on offer. 2 currently being rolled out, Pfizer and AstraZeneca. Are they equally good?
So the data you kind of read from different areas can be confusing. I've got an article from the Lancet from 3 days ago, and I'll read you what it says. And essentially the summary of the data is that it finds that the Pfizer vaccine is 91% effective and the AstraZeneca is 88% effective after the first dose. And this is for hospital admissions at 28 days to 34 days. And it finds they were similar for 2 doses when looking at above 80-year-olds, because obviously those were the cohort of population that they could get the data from, because they were collecting it from the 8th of December to the 22nd. And one can extrapolate that it actually will be similar, if not more effective, as you go down the age groups as well. And when I say 88% and 91%, that's also within the margin of error. So it's plus minus 4% for one of them. So essentially, they are just as effective as each other, basically. That's the key take-home message, that all these vaccines pretty much work in a similar way to achieve a similar result and are similarly effective. The only real difference being, from my perspective as a clinician, is that those who have quite significant allergies, we tend to offer AstraZeneca. And I mean, not significant in the sense that the way most people feel that they have a bad allergy. I'm talking about life-threatening allergies, multiple, unknown. So if you have a life-threatening allergy to, as an example, most commonly something like penicillin, we can offer both. That's fine. But if you've got multiple unknown, we would steer towards the AstraZeneca. The second difference is really in the under 30-year-olds, that given the risk benefit from what Piers has mentioned in his earlier presentation about the clots, that we're tending to not offer the AstraZeneca in the young, healthy 30-year-olds, under 30-year-olds. So I'll just be clear, healthy, because at this stage, with having maybe an average of 2,000 in the whole of the UK cases of COVID, the risk and benefit for those particular cohorts is very low. But above that, we are offering both vaccines. So I think those are the main differentiators from my perspective. But in summary, they're both as effective as each other, and so is Moderna. All of them are similarly effective, and they work in a similar way to achieve a similar result.
Okay, thank you. And there's a question here, which I mean, Piers kind of touched on one of the issues in his presentation, but it says, are you able to confirm that the vaccine is safe for BAME communities?
Definitely. Definitely, there's no evidence at this stage to suggest any additional risk for BAME communities by taking any of the vaccines. Quite the opposite. By not taking the vaccine, there is a much higher risk of COVID complications, and we know that. So, and this actually applies not just to BAME, but also to pregnant women. So now we are encouraging
pregnant women to get the COVID vaccine, which we weren't, for similar reasons that they are at high risk. So in summary, at this stage, with a huge abundance of data, there's no evidence to suggest any additional risk from any of the vaccines to BAME communities.
Fantastic. And there was a concern about it being Ramadan. Is it possible to get the to get the vaccine during Ramadan? Would you be breaking? Would you still be observing Ramadan? That's one of the questions that has come in. So
Ramadan is, you know, I'm a Muslim myself. I'm fasting as we speak, and Ramadan is something which we do have different opinions. You could say personal opinions, but the overwhelming religious authorities will say that it is permissible to receive a vaccine. Now, that being said, sometimes, when I say sometimes, up to even 40–50%, more often than sometimes, I should say, you do get side effects with vaccines, all vaccines, flu vaccine included, and the side effects are the same as the flu vaccine, essentially. So, and just like with the flu vaccine, if you're getting a bit of tiredness, achiness, and you feel that you need to take paracetamol, then that would invalidate the fast. That's a separate thing. That's a side effect after taking the vaccine. You're not ingesting anything orally that would invalidate your fast, like normal oral medication. In fasting, it is very clear, and this is unanimous, and there isn't any kind of differing of opinion on this, that if you are in ill health, you shouldn't be fasting. So that's a separate thing. So there will be individuals who will be taking oral medications, which, like even my mother, she's got a bit of a tummy problem where she has to take some medication, and for that reason she can't fast. And there'll be a lot of individuals in a similar boat for taking different medications. So, but those individuals who wouldn't be taking oral medication, who would be able to fast normally, should try and fast. You know, if they have an iman and they feel differently, that is obviously their choice, and they are free to break their fast if they cannot maintain their fast. And that's, you know, usually more of a next day side effect or a day after from the vaccine. So, you know, in summary, it should be fine.
Fantastic. Well, I hope that provides some reassurance. Maybe Fanny could take the next question. It says, I'm young and I'm worried if the vaccine will affect my fertility in any way. I know Dr. Hassan mentioned it's pregnant women. What about fertility? And people are worried about that.
Yeah, I mean, this is a very important question, first of all, and thank you so much for asking. Before I answer the question, I just wanted to say it's very important for all of us to acknowledge that some people still have legitimate fears and concerns about the vaccine, COVID vaccine in general. So we welcome all of these questions. So back to the question regarding fertility, I would like to assure that to date, there is no evidence suggests that this is a case. So COVID vaccine doesn't affect fertility at all. There is nothing in the vaccine itself that can affect fertility of women or men. If you look at all vaccination in general, the vaccination don't actually affect fertility. So the same applies to the COVID vaccine.
Okay.
Thank you.
Thank you. I mean,
oh, sorry. Just add that you know, a good example is mumps. Mumps MMR uptake was affected by wrong media a long time ago from a discredited. Now this affected fertility because people didn't take the MMR vaccine. So not taking vaccines and catching usually the infection is much more likely to affect fertility. And we are seeing that effect of libido and tiredness and other things from COVID. So just to make that clear.
Yeah, I'm going to add one thing to that as well. During the AstraZeneca clinical trials, so we have read in the data that some participants actually became pregnant during the trial. So this is just to highlight that it doesn't affect fertility at all.
Okay, great, fantastic. We've got some questions about the safety of the vaccine. Of course, I think it's fair enough for people to ask these questions. It doesn't make you a conspiracy theorist. I think it's quite natural for people to ask questions about it. So there are a few here on the list. I mean, the first one here, it says, just can the vaccine make you ill? Maybe Dr. Jonathan could maybe help us out here.
So the side effects that you can get with the vaccine, it's your body's immune response mounting a response to the vaccine. So it's not the vaccine making you ill. So in the same way, if your body was exposed to a cold virus or a flu virus, your immune system would get very busy fighting it. And so the side effects can be quite similar. So some people feel a bit achy all over, the same as you would do if you had the flu. Some people might feel even a mild temperature, in which case we'd advise some simple paracetamol. Fatigue is not an uncommon symptom. But I wouldn't worry about those. The most common symptom is to have a sore arm. They reported about 60% of people will have a sore arm, and it's not the injection technique of the person vaccinating you, it's your body having a local response. So, if you injected or had any foreign substance, even if you had a splinter went in your finger, you'd get a local reaction, you'd get a swelling there. So I wouldn't want people to worry if they don't get a reaction. But yeah, it's just your body responding to those things. Just to reassure you that the vaccines can't give you the disease. So all they do is tell your body some information about COVID, and it allows your body to build up its immune response, but it's not possible to get the disease from the vaccine. So yeah, I wouldn't worry about that. But yeah, the side effects are your body mounting an immune response, but most of them, some simple paracetamol or the passage of a couple of days usually settles it.
And is there an issue if you had bad side effects from the first vaccine? We've got a question here from Mary. It says, I reacted badly to my first vaccine, more than it said in the leaflet that was given. I had a stabbing headache for 2 weeks, which I've never experienced before in my life, and I felt very unwell for 3 weeks. Now, should I have the second dose or not, or should I be given another brand of vaccine for the second jab?
So the only real contraindications to receiving the vaccine is if you have a severe allergic response to the vaccine. So if you, for example, develop swelling of your mouth or your throat, difficulty breathing, what we'd call a very severe reaction, like my colleague Esan was referring to before, then we would never expose anyone to the thing that caused the severe reaction. So we would not recommend that for the second vaccine. But I have been responsible for supervising vaccine clinics that I think have given more than 25,000 vaccines, and I haven't, touch wood, found any issues like that. But if you have had a reaction to the first one, every vaccine clinic, there's usually 2 doctors there for discussion with. So you don't have to be cajoled into something that you're not comfortable with till you've discussed it with a doctor, if that's what you would want to do. And I'd say don't hesitate to do that.
Yeah. Okay. We've got a question that's come in on the Q&A while we've been on. In the first week of June, I have the second AstraZeneca vaccine appointment. Is this the injection that might cause a blood clot? If it is, what symptoms should I look for, and how quickly can a clot kill you? I don't know if you want to go for that, Dr. Jonathan.
Yeah, so the AstraZeneca vaccine is the one that's been associated with some press coverage and concerns and change in approach related to concern about blood clot. As far as I'm aware, none of the episodes of blood clot have happened after the second vaccine, and they've all been associated with the first vaccine in a very small number of people. So I would not worry if it's your second vaccine, but there has been some coverage around it regarding the first vaccine, and because of it, we've slightly changed our approach into which vaccine we're offering the younger people, and I think Esan touched on that before, and Piers kindly touched on it in his presentation.
Okay. Does anyone else want to add on that? Oh, Dr. Esan.
I forgot to mention, because of what Dr. Levy has mentioned, we've also erred on the side of caution. So those who have had a strong history of thrombosis, that's central venous sinus thrombosis, or a condition known as thrombophilia, or antiphospholipid, or they've had a major thrombosis with what we call thrombocytopenia, which is low platelets. We're just trying to be a bit more cautious with which vaccine we offer them. But they're so tiny, the population that we're talking about, that in my own practice, which has one of the highest numbers, I think the second or third highest in Camden, we're talking a handful. So it really is out of 19,000 patients. So really, really tiny minority.
Thank you. Thank you. I should say that if you are following along here and you do want to ask a question, you can put it in the Q&A. If we can't get to it live on the webinar, then there are people, more experts backstage, who will be able to send you a text answer. We want to get through as many as possible. We've got, moving on now to the vaccine rollout. Maybe Fanny or Dr. Jonathan, again, let's read it out. My daughter is due to go to university in September. Do you think she will get 2 doses of vaccine before she goes? Also, she's not sure whether she wants to have it anyway. Do you have any advice for young people who are not sure about being vaccinated? Maybe Anisha could help out with the answer. Young people worried about the vaccine.
I think there's definitely a stigma around vaccinations with young people. I think even I had my own friends, so they were concerned about the development and things like that. And I think a lot of that misinformation, it kind of came from 2 main places. I think it kind of came from social media, because there were sometimes the accounts that we followed, it was those type of ideas espoused really. And it was also sometimes from our own parents with WhatsApp group chats and things like that. And I think definitely one of the key things I would say is to definitely, I think, talk to someone about it. I think if you are really concerned, don't just keep reading up online and going up to more conspiracy theories, because I think that's what some people do as soon as they read one thing, and it goes into this whole entire sort of loop chain. And that's just probably not the best thing to do, not to read it like that, but to definitely maybe speak to a health professional and things like that. Because I know myself, because I've had 2 of the doses of the vaccination, and I had the Pfizer vaccination. That was because I was volunteering at the UCLH hospital, and all I know is I definitely didn't have such a negative experience as I was made out to be. And I remember some of my friends were telling me, oh, don't do it, this is going to, your fertility is going to be affected and things like that. And multiple friends were really concerned about that. And some were thinking, because I had pre-existing health conditions, that it would be made worse and things like that, which was not the case at all. I think my symptoms only lasted for about a day or 2. And to be honest, it just felt like I had a bit of a flu without the actual really worse version of the flu, if that makes sense. I wasn't really blowing my nose and things like that. It was more just I kind of just slept the whole day, really, if that was anything, and just a headache. And I think definitely one of the things that we have to do to encourage young people is sometimes what I've noticed is just talking, because what happened was when my friends, they had sort of, my teacher had listened to that, and my teacher was explaining how the vaccination was actually safe, and now they feel more encouraged to take the vaccination, because before what they kept doing was relying on social media and things like that, and that's just not the place to go. I would definitely avoid social media at all costs when it comes to things about the vaccination. And when it comes to even WhatsApp group chats, I really would not trust them. I would definitely start to consult, if you really are concerned, maybe to speak to your doctor and things like that, because I think they would be the one who can give the best information. Or if you have a trusted adult at school, that would be another really great way.
Okay, yeah, definitely pick what media you trust, and none of that nonsense online. Just while you're there, is there a complacency among young people? Do you think is it not? I mean, do they think that it's not going to happen to them, or they're kind of
yes?
Kind of from it?
I have seen that, and I just think that's because what I've had was loads of my young people, I think even in my own school and a different community, what they've said is, well, I'm young, I'm not really going to get the vaccination and some things like that. But there are some people who are also very serious about it as well. So I think there is definitely a very mix and variety, I think, of how people think. I think it really is dependent on people's sort of situations and things like that. But I know that it's definitely something very serious, COVID, even if you are a young person. I know myself that I've even had a close friend of mine even have COVID, and she's the same age as me, so 17. And I've even had my own younger brother who's 11, one of his friends had it. So it is definitely a very serious thing, COVID, and it can happen to young people. And I think that's something that just needs to be made very clearly, because I think what's happened is, to be personally honest, we don't really get to listen to much about COVID and vaccinations and things like that in schools. And I understand that it can be very difficult to understand. It is a very complex thing, and I don't really expect any young person to fully understand the whole concept and mechanisms behind the whole process. I think what we can really do is just sort of oblige with the things that have been put in place really by the council, the government and things like that. And I think to address that complacency, I think what would really be best is to, again, I just kind of think not to really trust those other outlets, just to be, again, very careful with who you trust.
Okay. And is there any of the panelists may be able to answer the first part of that question? My daughter is due to go to university in September. Do you think she will get 2 doses of vaccine before she goes?
Richard, I was going to come in on a little point. I mean, I can make an attempt at answering that question, but just to add to Anisha's point, I think one of the things that's really affected young people is, first of all, that their lives have been really turned over by this whole thing. And, you know, that's, if you know, for me, I'm not sort of trying to finish my education or get, you know, socialize, and I'm not in that phase of my life, and I've had the impact of it. So for me, a massive motivating factor to get vaccinated isn't necessarily my fear of COVID, it's the fact that I want to help get us all out of this and back to normal. And I guess, so if, you know, obviously you need to not be afraid of the vaccine. I hope the other panelists have shown how safe it is. But I think the other thing is that if you're just someone who wants to get out of this horrible situation that we're all in, if we all get vaccinated, we can get out of it as quickly as possible. So that would be something I would say to them. Yeah. I can have a go at answering the question about will my daughter be vaccinated before September, and maybe others could add to it. I mean, the government has a target of getting every eligible person vaccinated with their first jab by July, and there's a 12-week gap then before that person might want to go to September. So if the government is able to deliver that, and so far it's exceeded its targets on vaccination, I think there is a decent chance that your daughter and others will be vaccinated before university. But obviously with all these things, it's so dependent on, you know, all the logistics, the supply of vaccines and all of that. So I don't think anyone would stand up there and promise it, but I think there's a really decent chance.
Okay, thanks, Helen. That's great. Here's a question about the rollout. Maybe Sally can help. You do hear these stories going around that there's a kind of excess doses at the vaccination centres at the end of the day, and if you rush down there and get there before closing time, you'll be able to get one. It says, is it possible to access the vaccine at local centres by getting on reserved lists or going to the vaccine centre at the end of the day in case some doses are unused?
Well, you definitely can't rush down there at the end of the day and I'm afraid and get a spare vaccine. But GPs and other people providing the vaccine will hold reserve lists, but they are of the eligible population. And that is in case of people cancelling or not able to make their appointments, so that we don't waste vaccine going forward. So it will be a small targeted list. So please don't just turn up expecting to get a vaccine, because it won't happen.
Okay, thank you. And Lucy asked, I would like to know why my mum can't get her second dose of Pfizer vaccine. It's now overdue. The GP surgery says no appointments available in Camden. The system doesn't let her book online, and NLCCG hasn't got back to her. What can she do now? Is anyone?
Hi. So across North Central London CCG, there are a variety of different groups organising the vaccine centres. So it depends on the area you are, what the access will be. So for example, the group of GP practice that Esan and myself work alongside, which is the majority of the practices in Camden, we have a telephone access line that you can contact and speak with the people that will book you in. We are also, as far as I'm aware, in our areas, we match the vaccines depending on how long ago you had your last one. So for example, at the moment, if you had an AstraZeneca vaccine 9 weeks ago, we're inviting you now. So we're certainly not waiting till the 12-week window. However, I think it's worth contacting your local vaccine centre, organiser, or your GP surgery. Sometimes things fall through the gaps, and it's worth checking if you feel that you're overdue your vaccine. But overdue by the current definition is we're aiming to get everyone's second vaccine within 12 weeks. But yeah, that's certainly happening with a good 3 weeks to spare in our area of Camden.
Fantastic. Dr. Esad, I know you have to leave I don't want to keep you if you need to be away, but so thank you. If you
Yes, I was just going to add to that.
That's something, right?
It's the first doses that we're not getting at the moment much Pfizer. So second doses we're getting based on exactly what Dr. Levy mentioned about the first doses. So they are earmarked, and some patients are preferentially wanting the Pfizer for the first dose, which we're not able to offer at this stage in general. And that is the difficulty, because even recently, because 119 is another way if you are eligible, and there's also the website, the national website, which I believe is offering it to 45 and above as well. So, but again, none of those will guarantee you a Pfizer, because it depends on the delivery and so forth.
Yeah.
So if it's a second one, as Dr. Levy's mentioned, and you feel that you haven't been recalled by the 11th week, then do, you know, because by the 12th week is the aim, but as mentioned, we are going ahead of that if we have the supplies to deliver it. Thank you.
Thank you, Dr. Hassan. You've been a great help. I don't know if you need to get going, but I really appreciate all of your answers tonight. So thank you. We'll keep on going though with the kind of vaccine rollout questions. I think people are interested in the priority and how this is kind of filtering down. It's been a kind of well, we've got a question here. Are there any plans to roll out the vaccine to people in the borough who are pregnant as a priority group, as opposed to waiting until their age group is reached nationally? Maybe somebody, does Piers know that? Maybe Piers or...
Sorry, just trying to come off on mute. Failing miserably. So there aren't specific plans to go away from the nationally set schedule, which has gone from the groups most at risk of harm, and now we're following very much an age group basis right down to 18. So in light of the recent guidance and encouraging pregnant women to come forward, there's the recommendation as soon as your age group lights up, please come forward on that. But obviously, please do have a conversation with your clinician around this, just around the risks and benefits in advance.
Okay. And just on that, Mark has put one in the question and answer box. It says, what is the schedule for vaccinating young people if they have a background of respiratory issues? An 18-year-old, if they have a background of respiratory issues, can this be a justification for having a vaccine earlier?
So I might defer to one of my clinical colleagues, but in essence, the schedule has been for those people that have long-term conditions that are at a sufficient level at any age for them to be eligible for the flu vaccination, then they have been identified as priority group 6. So obviously right now we're in several groups below that. So if Marcus is known to his GP, and then he should either have been called or can actually access this. I don't know if Jonathan, there's anything you'd add for that?
No, I think you've hit the nail on the head. So if you have a long-term condition, so if you're young at the moment, we're vaccinating just about over 40s in our area of Camden, but if you are over the age of 16 and have diabetes or asthma or chronic obstructive pulmonary disease, that would put you in group 6, and you should have already had an invite. So yeah, if you are asthmatic receiving regular medications from your GP for asthma, you should have had an invite, and if you haven't, I'd contact them again. A lot of the searches that we would do are automatically done by clever computer programs, and they can miss things depending on the nuances of the coding. So if you are an asthmatic, you should have been offered a vaccine. If not, get in contact with your GP.
Fantastic. Got some quite short, sharp ones. It's, can I get a vaccine if I don't have an NHS number?
So that would be a yes. And there's a difference behind this in terms of you don't, if you have an NHS number and it's a problem with recalling it, you don't have to come up with your NHS number to access it. But I think the issue behind this is if you're not registered with the NHS in the first place, perhaps, And I think there's a really important issue around this. Obviously, we clearly encourage everyone to be registered with the general practice so that you can benefit from the wide range of care and preventative support. But if you're in a group eligible to receive a vaccine now and you don't have an NHS number for whatever reason, 119, you can call that free of charge. Gets a bit busy, but it's 7 days a week. And once you get through to them, they can make arrangements to book a slot.
Yeah. Okay. I mean, there's a kind of follow-up question here. Is it that's come through on the Q&A? Is that how will we ensure those who are rough sleeping in Camden have access to the vaccine if they want it? Maybe they don't have an NHS number, or is there a way that people can be helped?
So we are specifically working with homeless services, hostels, and the others around. One of the key threads of the vaccination program is around people coming to fixed sites when they're invited. And another thread of it is in terms of the kind of outreach and coming to risk groups, if you like. So, for example, people are housebound, have been vaccinated at home. And by the same token, we've been working with providers who have come into homeless hostels and other services to vaccinate homeless people. The work isn't complete, but that's been the approach taken.
Okay. So move on to accessing clinics. And Veronica asks, how can patients get access to their GPs when many of the practices are still officially closed since COVID-19 began? And many GPs seem unwilling to see patients. This is especially in the context of possible and existing cancer patients who deserve to be particularly considered and encouraged, but sadly are too often not since the start of the pandemic. This is incredibly important because there is a campaign to encouraging P&P to visit their GPs, but we hear too many examples of practices still refusing to see the patients even after telephone triage. Maybe Sally could help.
Yes, I mean, just to say that practices are open, but obviously they've been asked to operate in a different way at the moment, and under COVID they had to operate very differently, and that has continued since the COVID peak has reduced. Cancer services have been open, cancer treatment services have been open throughout, but some of the screening services haven't been operating, but they are up and running again now. Just going back to the sort of getting access to your GP, most practices are having a telephone triage service, but they are also offering other ways of contacting them. Clearly, they're getting a lot of queries and telephone calls at the moment, so being patient with that. But they telephone on the website, they will give information about other ways of contacting them directly. And if you need a face-to-face appointment, they will offer you one. So even though the doors may not be open in the way that they previously were, that they are very much seeing patients, and lots of them. If you can't get through to your GP for whatever reason and need to see somebody, then you can always ring 111 and they may have access to additional GP appointments that they could link you into as well.
Okay, thank you. We've got a few that are coming up here again on the question and answer. So thanks for sending them in, the people who are joining us tonight. What about young people under 16 with health conditions? There seems to be inconsistent practice with some being vaccinated. What is happening in Camden? I didn't realise anybody under 16 was being vaccinated. Is that? Can someone help with that one?
Yeah, so there are currently trials that have been in place to look at this, but the programme is for 18 upwards. I don't know if you've anything to add to that, Hannah.
No, we will vaccinate 16 to 18-year-olds with Pfizer if they're at a significant risk, but beyond that, I'm not sure. I'm not aware of any vaccinations going on, but it might be that there are highly specialist clinics and specialist paediatricians making alternative approaches, but I'm not aware of them.
Okay. And can you get help with physically getting to the vaccination site in terms of transport support or money for transport? Piers, do you know about that?
Yeah, sure. So clearly there's a network of local vaccination sites, trying to make them as convenient as possible, but that won't work for everyone. I mentioned before around if you are housebound and your GP knows about that, then you can receive your vaccine at home, and many residents have and have benefited from that. If you're not housebound, but you need support with the vaccination process, you can be helped through the council support line. I'll say this will hopefully go in the chat bar as well, but 02797444444, option 9.
Okay.
And there's also specific support available for wheelchair users. When you book your vaccination appointment, your GP will be able to book wheelchair accessible transport to take you to and from the appointment. And finally, if you have a learning disability or you support someone who does, you'd like some support, then the Camden Learning Disability Service is there to offer advice and support.
Right, where are we up to now? So we've done the transport. This one, I mean, this might again be for you, Piers. This is, I would like again to ask for the data on uptake of the COVID vaccine by qualities group to be shared. I've asked previously as a COVID champion and been told it cannot be shared. I'm interested in all levels, but particularly Camden level information. Along with the data, I'd also be interested in reflections on learning from the efforts that have been made to increase uptake and decrease health inequalities.
Okay. There's a lot in there.
Yeah.
But so
yeah.
just the first thing to emphasize is clearly we've all been working to ensure that as many people as possible are protected by the vaccine, especially those at greatest risk of harm. I came across a recent work from the Office for National Statistics. They gave a good overview at the end of March for the first 3 months of the programme. And they were looking at those aged 70 and over. And they confirmed what a lot of stuff that we've seen reported in the news, but vaccination uptake was low among all ethnic groups compared with the white British population. Lowest rates amongst the Black African and Black Caribbean population. Vaccination rates differing by religious affiliation. Lowest rates amongst those identifying as Muslim and Buddhists. There was some difference for disabled people versus non-disabled people. Again, a gap, not necessarily massive, but a difference. And something that has been a concern since before the vaccine program started and its implementation, in terms of a difference between those living in more deprived areas with a lower uptake compared to those in less deprived areas. So that's kind of a national sense behind it. And although data is publicly available on uptake within different age groups across London boroughs, it's not currently published by ethnicity or other equalities group, although there are moves for this to happen soon. But we are fortunate in Camden to, and as do other areas as well, have access to general practice data for our local planning. These data are for people registered with almost all the Camden GPs. But the caveat is it's not the same as data on uptake for our residents. These are the registered population. And there's a bit of a lag behind it. But the data gives us important local insight, particularly in relation to ongoing lower uptake among our Black communities, age 70 plus, which we're seeing across the capital as well. This is still an important gap, albeit the gap's closing. In terms of the kind of response around this, I'd say that there's been a load of information where we've been amplifying and tailoring vaccine-related information for many different communities pushed out through many different channels. People on this call hopefully will have seen some of this and may have been involved in promoting this further. I've been really impressed by the reach of these collective efforts. We've got information to improve vaccine confidence and address common concerns has been given to community and faith leaders, as well as COVID champions, and I know there are at least a few on this call, to adapt and send out through their communities, through groups, WhatsApp groups and one-to-one interactions. And I put in my presentation the clinical and community leaders who've been offering their faces, if you like, and views on the benefits of getting vaccinated. which have also been widely shared. I think a key learning for me from this whole program is that when each of the priority groups has become open, then we found inequalities of uptake being established very quickly in terms of impact of deprived areas or ethnic groups. And this has narrowed over time. There are still important gaps, but it's a familiar pattern behind this.
I think Councillor Gould, you wanted to jump in as well. Are you there?
Yeah, I think it's a really important question, and I think we have seen in Camden and across London significant differences between different ethnic groups, and particularly Black residents being less likely to come forward to take the vaccine. And as Piers says, that gap is narrowing, but it's still there. And in terms of like what we've learned about it, we've been doing some pan-London work to really understand what works, and a lot of the issues are about access. I think some is put down to, all of it's sometimes put down to hesitancy, but sometimes it is about access. And so some of the things that have really worked are local community run pop-ups and working with community venues. There's been some evidence around vaccines going to people, and so we're really excited that tomorrow we're launching Camden's vaccine bus, where the booking will be through local community groups and working with vaccinators from UCLH Hospital, and again with the hope that kind of makes accessibility easier, and having community settings where people can walk in with lower barriers to access. In other places that's really helped. And we've also been with our own staff making calls and talking to people about the vaccine and making sure that we can answer questions, and seconded 6 Camden staff into the NHS to support some of that outreach. And we continue to kind of share some of that learning across London, because it is a real concern that we've seen that the pandemic has had a disproportionate impact on Black, Asian, minority communities, and that there are differences in terms of vaccine take-up. So thank you for raising it.
There we go. The vaccine bus is coming. So I'm sorry to jump around because it's obviously people are raising questions to answers that have already been given in the question and answer. So it might be a kind of a bit of a strange order, but someone's asked, do you advise paracetamol before the jab in anticipation of side effects? If not, why not? Maybe one of the doctors could, yeah, there we go.
So I don't. The side effects are not that common. So when I do vaccine clinics, the most common thing I hear is, I wasn't even sure I was given it last time. Did I definitely get it? Because the side effects that I talked about are really the minority of patients. So yeah, it's not common enough that I would say that you should preventatively take some medication. But, if you were worried about it, paracetamol is fairly harmless in the correct dose. And, I wouldn't say that's a terrible thing to do, but it's not something I would advise my own family and friends is necessary.
And just on a logistic thing, if my second vaccine appointment is in Edgware Road, and I live in Kilburn, close to Bronsbury Medical Centre, my GP, is there any nearer venue I can transfer to and not lose my June the 7th date? I guess that's a question about whether you can choose your location of your vaccine, or is it, once you're told you're going somewhere, you have to go there? Maybe Sally there, maybe, or maybe Doctor.
Jonathan, I think that as far as I understand it, they have to book with a particular site,
right?
But there is some flexibility about that, but obviously it needs to be booked with a particular site in advance.
Okay, thank you. And again on priority, how will people living with HIV be prioritised? Maybe Piers, or Helen, maybe. Do you know that? Is it the same answer to the previous questions?
I have to say I don't know for sure, but what I would imagine is that it's a conversation with your health practitioner who would know whether your condition, because HIV can be very well managed and there isn't I'm really stepping on the grounds of the actual medics here, but you know, you can have extremely well managed, so you're not considered hugely immunocompromised, and then there can be less well managed HIV where someone is very immunocompromised. And I'm not sure whether having HIV automatically puts you into an immunocompromised group, but perhaps Dr. Levy would know more about that.
Do you want to come in? Or?
Yeah, I have to say, I don't know offhand without recalling what the previous searches for cohort 6 were. But I think that, again, so we have cohorts, but we also have flexibility. So we have people outside the defined criteria, but we know as their doctors that they are at higher risk for one reason or another. So we always have flexibility in making decisions if it's appropriate. So if somebody has HIV, hasn't been offered a vaccine, I'd certainly encourage them to get in contact with their GP, who could then have that discussion with them.
I understand that everyone with HIV is automatically in priority group 6, as long as their GP is aware of their status.
Okay. Hopefully that helps the questioner. We have got some questions that are it's not every single question is about vaccines. There's a question about the easing of restrictions. There are some questions about easing of restrictions. I think it's kind of an interesting time, isn't it, where we can kind of almost see a kind of step back into normal, and we can, some of the things that we like doing are opening up again. But as Piers said at the beginning, it's a careful step, isn't it? And so we have some questions about the next few weeks, I imagine. With the reopening of Camden Lock Market and the possibility of large numbers of visitors to the borough from outside mingling in the confined spaces of the area looms, what challenges does this present to COVID prevention measures, and how will you be monitoring the outcomes? I think you, maybe the public health officials and the council.
Thank you, Richard. I'll kick off with that one. So clearly right now, we're in the middle of a balancing act between immunity growing from the vaccination programme as it reaches further across the population, and easing lockdown measures as we can't all sit at home forever, clearly. Just got to get the balance right. Public health and environmental health officers are working with organisations across the borough to make sure they're well supported with the advice they need to reopen and maintain services safely. But there are and will continue to be challenges around this. In relation to Camden Lock Market, we're very aware of the significant challenges linked to the ongoing increase in visitors to the market. Camden Town and the market has been identified as a key priority area within the local reopening partnership plan. And increased visitors and concerns about overcrowding in some areas over Easter, in fact, led to a series of actions. So, for example, I understand there was a revised queuing system at all main entrances to the market, going for booking only systems, improved information sharing between security and council inspectors, and a daily monitoring schedule. And linked to the monitoring, there's a local partnership forum which helps coordinate monitoring throughout the phases of the COVID-19 roadmap. There's a partnership patrolling rota, which is developing, and this gives on-site high visibility monitoring within the market and the wider Camden Town area to identify issues and enable early intervention. In terms of monitoring infections from a public health perspective, we monitor these regularly, including reviewing infections across and within the borough. So as well as rates within different age and ethnic groups to identify any emerging issues and then respond accordingly. We also receive data around potential clusters and outbreaks of confirmed cases of COVID-19 as well.
Okay, I mean, I think people have kind of feel the message is that if you're outside, then there's a low risk, but with a large amount of people, is that there is still that risk there? Is that fair to say?
Absolutely, and being outside in itself reduces the risk so much more considerably compared to being indoors. Circulating air, UV light, and so on, as long as we maintain the sunshine. But if you are in very crowded places and it's difficult to maintain the social distancing and just being able to keep apart while you're enjoying yourself, then that's where we may need to help out and help take further action. Helen, I think you were coming in on this from your hand up?
Yeah, it was, I mean, in total agreement with what you said, and just to add, in terms of if the inquiry is worrying about, you know, people catching COVID by going to a location and then going away and then not knowing where they caught it, and how would we know that the place that they'd caught it was the source? So this is some information to reassure them, which is that when you get a positive test for COVID, you're then called up by Test and Trace, who ask you not just where you've been in the 48 hours before you got your symptoms, but actually where you've been in the 7 days before, because that's looking at where you might have been to have caught it, not just to have passed it on to others. And all that information on all the positive cases is put together. And there's a whole thing called backwards contact tracing that happens, or enhanced contact tracing. And it's a really growing area of activity, which we're getting quite excited about. So it's, you know, as there are fewer and fewer cases, especially, it's going to be easier and easier to work out what are the places which might be problematic. So I think, you know, if it turns out that Camden Market, for example, was where people had been catching COVID, that should be seen in our data, and then we work really closely with our environmental health colleagues to then respond and, you know, hopefully change the way things are working. So hopefully there's a way of...
I think there's some confusion, isn't there, about outdoor numbers. So, you know, if you can only have 6, why can't you have 7 if you're outdoors? Some pub tables that you see people sitting around, they kind of might as well be indoors, they're so close together, I suppose. I think isn't there a kind of confusion about why is there only 6 outside, and you know, in Camden town on busy days, you might feel like you're kind of squashed in. You know, you might as well be with all your friends, 30 of you walking down the road if you're in Camden town. Is that?
I'm happy to say something on it, but Piers may have more to say, which I think with any rule, there's going to be a bit of the rule where it feels a bit bonkers, or it doesn't make sense. And there's the national rules, which are trying to be really simple. And then locally, we have to just be sensible about how we implement them. So in places where it becomes really overcrowded, essentially that's a bit of a problem, isn't it? And we need to respond to that. We need to listen to people. We need to listen to our community where they identify those problems, and then try and support those shops or those restaurants or those outdoor settings to change what they're doing. And there has been that ongoing dialogue. So I mean, we've had all sorts of exciting conversations about queues for crepes, and you know, there's a constant dialogue responding to the intelligence and information we get from our residents. So hopefully those kind of things will be ironed out, but nonetheless, they're always going to be picked up. There's always going to be photos in the press of things that look a bit bonkers, and hopefully with time we can help it be sensibly applied.
Okay. You can't keep people away from their crepes. Okay. Georgia, maybe this one's for you. It's a kind of a policy one, I guess. It's if an HMO tenant is not abiding by lockdown regulations, this is from Kirsten, and has people to stay, including the use of the communal facilities, who can the other residents expect to enforce those regulations and keep them protected when the police and landlord will not? Whose job and responsibility is to protect the other members of the household?
Thanks for that. I'm just going to quickly say something about the last item, and then I'll answer that.
Sorry, I didn't realise you wanted to come in, sorry.
Don't worry. Just to say that I think we're really encouraging residents to wear masks if you do find yourself in a busy area. And I think that the hands, face, space guidance is about trying to maintain social distancing. So social distancing should be happening. And so if you're in somewhere that's really busy, the first thing is to put on a mask, and if it is really busy, move away from that area, because people shouldn't be crushed up against each other at the moment, and we are in the rule of 6.
You must have seen the pub gardens; they're bursting.
I have, and so I suppose our job there is to try and work with businesses, with the market, with whoever is in the borough to kind of maintain the guidance and to keep things as safe as possible. And we've got a whole new team, an extra 20 officers, so 40 people who are going around the borough working with businesses and trying to keep that in place. And people, if you have concerns about a particular premises, then please do get in touch with the council. So in terms of that question about HMOs or an HMO, I think that it's in terms of enforcement, it's really the police that should be leading enforcement. But if it's an HMO, councils also have a role because of our kind of landlord licensing work. So I'd encourage the whoever has that issue to call both the police and the council. And if you call the council to do that on the number that Piers said, which is our number for all things COVID, 974 4444 9, and talk, one of our community presence officers can go and talk to those individuals and lay out the rules and do the kind of encouragement. But when it comes to enforcement, I think it will need a police intervention.
And that's the same if for anybody's residential. Is it if your neighbours are having a party next door, what should you be doing? I've got lovely neighbours, by the way.
If it's a party, definitely calling the police. That is 100% a police matter.
Right. Okay. And I know this is something that you were really interested in over the last 12 months, and I know you've taken a lot of interest in. Please, may we look at the beginning of the pandemic and Camden support and what is actually happening today. I'm a disabled resident. There were some hiccups with food parcels to begin with, but then okay. But I feel I need help more than ever, having lost one self-employed job and my need to care for my family in crisis away from Camden and my own deteriorating health. Is the help still out there all these months later?
Yeah, I'm really sorry to hear that you're having that experience, and I know that we're seeing overwhelming needs, and the poverty crisis we're seeing is, I think, as bad as the public health one. We've seen new claimants for universal credit and other benefits go up by 173% in Camden, and lots of people experiencing exactly that, needing extra support with food and other kind of basic things. So it's a really important question. So yes, there is still support available. So if you're not able to access food, again, I'm going to say that number again, but I'd really encourage you to call the council line because they can refer you into food support. And there's also a website that we've set up now with voluntary sector partners called findfood.camden.gov.uk. And you can enter your postcode and find all of the organisations that are offering support around food. And there's so much still going on, and so many community organisations recognising that this is, supporting food poverty is going to be a long-term need and a long-term ambition of the council. So please do get in touch. And if you're worried at all, anyone on this call, then please reach out.
Fantastic. I quite like this one because it's often the older residents say everything's happening for the younger residents, and the younger resident says it's all you'll care about is the older residents. So, and we have that every week in the paper. But here goes. This is Sue. Going forward, there seems to be quite a few things being put in place for young people. But what about activities for older, retired Camden residents who have spent most of last year isolated from friends, family, and grandchildren? One of the things that the GPs are revising are people to get out, meet people and walk. But to my knowledge, as a volunteer Camden community champion, I'm only aware of 2 walking activities available: the active walking route run by Camden and one run by Help the Aged, who have advertised around local green spaces, Talacre, Hampstead Heath. What plans, if any, are there for the start up of activities for older and retired residents of Camden? Is that you, Georgia? I think maybe you could help, Georgia.
I'll start, and maybe Piers can come in as well. So yes, I think things are really starting to open up in terms of community activities, both for young people and for older people. And I know that Aging Better has a list of on their website, where you can put in the chat, of the activities that are already open for older people. And over the summer, we're working on, as Camden, with a lot of our cultural organisations, a whole range of outdoor activities around the borough, recognising that it's still much safer. It will still be much safer to be outside and come together outside. And we've got all these amazing cultural organisations that have been closed through the pandemic. And so I'm hoping that from August to October, there'll be a whole load of very exciting outdoor events that the whole community can enjoy. And we will be kind of sharing that information. We'll get something about some of the activities for older people in the next CNJ edition, Richard, and so people know what's there. But Piers, I don't know, in terms of the individual walking, if there's, I don't know if you know anything about the kind of activities and sports and leisure side of things.
Thanks, Georgia. So there's information available on our council web pages, which I think we should put up in the chat. across the piece for all adults. And I think this really highlights a really important issue, because we know such strong research about the importance of being active for your health and well-being, but also for maintaining your independence. And certainly it's something which we need to keep our eyes all over in terms of those people who perhaps are at the frailer end of the spectrum, you know, whether the reduced in activity during lockdown actually tips them a bit further so they're less able to live independently. Clearly not from the questioner's viewpoint, but there is that kind of balance of a mix of activities that people enjoy. So George has identified several of the group sessions which people get a lot out of, clearly social interaction, obviously socially distanced, but fitting in with what's available. But there's a key line behind this around fitting into your daily life the activities you really enjoy as well. So almost the active choice needs to be the easy choice. And there's stuff people can do on their own if they wanted to in their own homes. The stuff they can do together, starting to open up this program in the borough. I think there are a range of activities on Hampstead Heath that are up and running. And in time, we'll have activities within indoor venues coming for groups as well. And I know Jonathan's got his hand up to probably give a much better viewpoint.
No, just from the general practice point. So we struggle as doctors to know what all of the local activities available are, but most GP practices nowadays have an associated, what we call a social prescriber, and it's somebody specifically armed with the knowledge of what's happening locally in your community around you geographically, and also Camden wide. So there's several avenues to look, as Piers and Georgia have mentioned, but there's always that additional option. Call your GP, ask to put in touch with the social prescriber.
Is Anisha still there? She's still from Fit. Maybe she's not there still. Maybe she's gone. I was just wondering whether there was kind of stuff that Fitzrovia Youth in Action could say they're doing for younger people as well. But maybe we should come back later. There's just on this this same kind of theme. Is many people are becoming increasingly inactive with closure of services and the fear of using gyms. How are the council, local NHS supporting residents to become more physically active during the pandemic? We can't get to the gym, unfortunately.
Not the end of the world, though, Richard. But
yeah, I'm very disappointed.
We won't get into your personal exercise habits, shall we? So I think there's what we've seen in lockdown, that obviously it's affected people in many different ways. And if we think around health-related behaviours in general, lockdown has actually helped to reduce smoking levels. It seems to have increased alcohol intake. There's been less drug use, but there has been, on average, lower physical activity levels. There's been a report that came out from Sport England this month, which kind of looks at the insight behind why activity levels may have dropped. And the kind of science behind it, if you like, behavioural science, is motivational issues and also a reduced sense of being able to be active. But also important to bear in mind that the 2021 lockdown kicked off at the start in the coldest and darkest months, which is never a good time to consider being active, and it's extremely challenging. This report talked around the kind of the change in attitude that may be influencing motivation. So in terms of the impact of vaccine rollout, easing restrictions, people's attitudes potentially changing around this, but also many of London's gyms are reporting quite a brisk return as well. But obviously some people remain cautious about returning to organised activity, particularly indoors. I touched on this in the previous answer, but I think it's really worth emphasising in this. If we are really looking to support less active, inactive people to become more active, the key is to focus on activities that you fit into your daily life, based around the home. They're flexible, often free, moderate physical activities. Research constantly underpins these principles, and there are a number of approaches and actions that are being taken. So, for example, if Jonathan was talking to me, as he's not my GP, but if he was my GP, there's very clear evidence that healthcare professionals can be very influential in terms of triggering people's first steps to be active. They're not everything behind that, but there's something we're supporting a number of healthcare professionals to have good conversations about being active. We've already mentioned around a range of information on websites. There's a document called The Ways to Move More in Camden booklet, and we've cited the Better Aging Camden information as well. But three things linked to COVID is worth highlighting in terms of promoting active travel. So clearly during the pandemic, there's been more cycle lanes added, which has extended the infrastructure, supporting our aim to make the active choice the easy choice. There's another approach around, and I'll be quick to wrap up, sorry, but using existing resources better. I don't know if you or any other on the panel have used the Couch to 5K app or are potentially aware of it. Perhaps running just isn't totally your thing. But during the pandemic, the sport and physical activity promoted this to groups less active, so certain Black and Asian groups and more deprived areas, and being able to use a tried and tested tool within a given area. And I think there are more than 50,000 people in those areas who have reached. And then the last thing around building on the growing popularity of parks and open spaces. This resource, this vital health and wellbeing asset at the heart of our communities, kind of coming into its own in Camden, and clearly that people have been accessing them quite a lot. We need to make sure more people do, provided obviously they have the space to do that safely.
Okay, we've got about 10 minutes left, so I just want to rattle through as many as we can at the end, maybe just a couple more. Is there any more known about possible booster jabs in the autumn?
Shall I give it a go with my crystal ball?
Yeah, I'll be quick because we've got a couple more. So if that's okay, Pip.
Okay, so nothing definitive. A lot of talk about it. Clearly, as Helen mentioned, we've got to get through the first jabs by July. Fingers crossed. Up to 12 weeks for the second, and then there's talk around looking around this booster jabs in the autumn. There's no specific details to share on that yet.
Okay, and if the vaccination uptake in Camden stalls for whatever reason, will Camden GPs, public health, NCL, CCG consider more targeted approaches, as has happened in other parts of the UK? They give an example of Bradford here.
Yeah, I mean, as Georgia said, we've been working together as a partnership to make sure that we are doing as many different things as possible to reach different sections of our communities in Camden, and we will continue to do that. I think we're really determined in Camden to make sure that everybody has access to the vaccine and as many people as possible receive it.
And then we've got a question that's come through. I mean, this is quite close to my heart, is the way we've been reporting the pandemic, and I feel that there's been kind of a lot of a lot of talk about statistics and graphs and people giving out the information at 5 o'clock and is it up or is it down? But as a paper, we've been trying to kind of make sure that people who have died are not forgotten and not just remembered as a kind of mark here. So we've got on the charts and the spreadsheets. Obviously, they're all important, but everyone is a life lost, isn't it? And we've got this question here: can we have a consideration? Maybe this is for Georgia. Can we have a consideration of a lasting memorial to the memory of those who have lost their lives, their loved ones, or those who've been affected in some other way by COVID? I'm not necessarily thinking about a statue, but something which acknowledges those who live, work, and study in Camden have been impacted by this global pandemic. The memorial wall is a good example. Maybe Georgia can help. Are there plans for some sort of remembrance?
Yeah, I think it's something we really want to do, and as you said, it's this disease it's really important to remember the way this disease has kind of ripped through people's lives and the loss that our community has seen, and that every one of those statistics is a member of somebody's family. And it has been an incredibly painful year, and also that people haven't been able to grieve together in the way that we might normally be able to do, and that has been very difficult as well. So we don't have a plan yet of exactly how we want to do it, but we know we want to have a way of remembering people in Camden, and we're really open to ideas and want that to be a kind of public conversation. So I know that there's a couple in the question, but yeah, it's something we will be taking forward.
But the council is also working on kind of recognising people who did go, put under kind of unbelievable kind of effort, all parts of the community. I think you've got a scheme that is playing as a We Are Camden.
Yeah, thanks, Richard. You're doing my job for me there. Yes, so we do. So yeah, we're really looking to celebrate our kind of our extraordinary community activists. There's so many people who came forward to deliver food, to help their community in so many different ways, and the kind of generosity and love that Camden showed was extraordinary. And we want over the summer to really celebrate that positive community spirit that came out of the pandemic. So please do nominate people who, whether it's on your street or a staff member or a community organisation who really went above and beyond. And I know that somebody will put the link, I'm sure, very shortly in the chat. And also, while we kind of work on a more permanent memorial, we do have a webpage which has where people can leave messages about loved ones that they lost over the last year, and has kind of information about services around bereavement. So I'll also put that in the chat.
Okay, fantastic. Well, we got through quite a few questions there. I wondered whether anybody wanted to sum up at all as we finish up. I know Piers did a nice presentation at the start. But does anyone feel like we haven't covered everything, and they were, oh, I was burning to answer that question and I never got a chance to ask? If now is the time to jump in and say, well, don't worry, everything's going to be okay. Right? Georgia, do you want to say a few words to finish?
Yeah, sure. I think it's really important that we've had this conversation. I think it's been really open, and thank you, Richard and the CNJ, for hosting it and for creating a space to have these kind of important conversations. And people have had lots of questions, and I think it's important that people come forward and ask those questions. And if you're at all nervous about getting the vaccine, much better to either call your GP and have a conversation, or if you're not comfortable doing that, to call the council. And to get those questions answered, and to have these kind of conversations. And also, if people have ideas of how we can make the vaccine more accessible, whether that's some of the ideas we've put forward around the vaccine bus or community pop-ups, or around how your GP can make it easier for you to come forward, then do send us an email or give us a call. You can email me directly, because it's so important that we do all come together to take the vaccine. It's the best way to get us back to normal life. And we've recognised today that the loss we've seen and the difficulty and the trauma of the last year and a half, and our hope is that this spring and this kind of starting to move forward is a real shift and a change. So we want to make sure we're supporting our community. So thank you for being here and giving your time and putting across your questions.
Yeah, I think we got through most of them. If there have been people answering the questions on the Q&A that haven't been answered, and if you're on the call here, if you still have questions, I know that the council and the other people here today will be happy to go back and answer them at a later stage. And that number again is Camden Council. It's on 0207 974 4444 option 9. And there's advice and all sorts of help you can get from there. On Camden Council's insert every week in the Camden New Journal. Follow them on Twitter as well. They've got a newsletter every week, which is really good as well. You can get emailed and you get all the latest updates to services. Look at the New Journal might grumble a lot about the council, but it's done a great job with the communications on this, I think. And I just say thank you to everybody who's put a question in tonight, but especially to the people who have come and answered the questions, because there's some quite hard questions, and quite when it's coming to Q&A, you just don't know what's going to come at you. So I really appreciate all the panelists that have come here, and all of the council staff that have been helping out behind the scenes. So thank you to everyone who came. All right. See you later.
Thank you.
Thank you.
Richard, thank you.
Cheers.